Welcome to SDS Thursday. My name is Dr. Budnik, and I'm a director of SDS Seminars. And today I have two people here with me. It's Paul Grantham, the founder of SDS Seminars, and Dr. Andrew Beck. And Paul will tell you a little bit more about Andrew, but Andrew is CBT therapist and a former president of BABCP, you know, that organization for CBT therapists. So today's evening will be dedicated to the topic of supervision. But before we move on, I will, as always, ask you to start typing. And I believe you can type so that everyone can see your message. I think we fixed it. So please go to your chat box and tell us a little bit about yourself. So what we are always asking about is where you are in the world or in the country. And today I probably can ask you, is it cold there where you are, or is it warm? Because it's quite cold here in Sussex where we are. What is your professional background? What kind of setting you're working in? Are you working in the NHS or private practice or third sector? Are you working with adults or children? What is your sort of area of expertise? And because we are talking about supervision tonight, are you a supervisor or you're receiving supervision? So what is your relationship with supervision? Because we are offering a training course on supervision, I will show you how to get there in a minute. I'm interested whether you've done training with Paul on clinical supervision, or whether you've done training on supervision in any other setting. So anything to do with supervision, please let us know. Also, I'm always interested, is it your first SDS Thursday? And if it is your first, how did you hear about us? Whether you've seen an advert in Therapy Today or a psychologist, or maybe it was word of mouth, maybe somebody recommended us. That's always very nice to hear, so please share with us. And if you've been to SDS Thursdays before, just tell us how long you've been with us. Have you been to any other SDS courses? So anything which you think will be of interest to us, and also to Andrew, who doesn't know you as well as we do, because we see lots of familiar faces who we've seen probably now for several years in the evenings. And also what could be of interest to your colleagues, so they know who is in the room. And I'm so glad that messaging is working, so you can all read your chat messages. While we are still gathering, Paul, I will leave the waiting room on you from now. Yeah, I will just quickly share my screen so you could just have some more information about SDS and how to find us and what we are offering soon. So we are a UK-based company, and we are providing continuous professional development in mental health field for mental health professionals. And to find us, you put skillsdevelopment.co.uk in your browser, or just do a Google search. Do a Google search for SDS Seminars or for Paul Grantham, and you will find us very easy. As I said, Paul is running a BPS-approved certificate in essential supervision skills, and one is coming up quite soon in February, 20th and 21st of February on Zoom, and it's still on early bird discount. I didn't even know that, so that's very lucky. So it's still on early bird discount, and you can book that course. We also have a full certificate where this course is followed by advanced supervision skills. So please feel free to have a look at it. It's a very, very popular course. So please book it early if you're interested in supervision. And now just a couple of words about Andrew Beck, because Andrew has been our friend for many years now and delivered. When I actually looked at his description on our website, I was really impressed with how many courses Andrew's done with us. So there he is, Dr. Andrew Beck. And here are the courses which Andrew did with us, starting with post-traumatic stress disorder and working with children and adolescents in CBT, tics and Tourette's, working across cultures, therapist burnout and trauma, all sorts of courses. And you will discover, if you haven't worked with Andrew before, you will discover tonight wonderful presenter. So if any of the courses which Andrew delivered for us in the past are of your interest, you can book them on our website. Okay, so that's all I wanted to share with you tonight. And now I will pass the microphone to Paul. He will tell you a little bit more about Andrew Beck, our presenter, and you carry on typing in the chat box because we are still interested in you. Paul, please. Thank you.
Yeah, welcome, folks. Andrew's going to take us through this evening a presentation, really, which is, it's got a great title, which is How to Get the Best Out of Your Supervisor. To give you a bit of background on Andrew, if you've not worked with him before, he is head of clinical health psychology in Bradford, but also has a background in terms, quite extensive background in terms of working with children as well. He's been supervising for 23 years, and like, I guess, so many folks who act as supervisors, it struck him at one particular point that actually he'd never received any training in it. And that, can I just say, it's a whole big itself, which we'll leave to one side at the moment, but it's not unusual at all. And so his own training and his own development subsequent to that led him to become particularly interested in what might be seen as broadly good practice with supervision. And I'm sure you're aware that there's a number of issues that crop up for both supervisors and supervisees within this, but the one that Andrew is going to concentrate on this evening is basically from a supervisee's perspective, which is how do you get the best out of supervision, how do you get the best out of your supervisor. So I wait with burning pen, Andrew, for lots of interesting ideas that I can jot down. I will say no more, but to pass you over to him and to say, the floor is yours, Andrew. Thanks very much.
Thanks, Paul. Thanks for that lovely introduction. Good to see you all, and really nice just looking through the participants list, and there's some very familiar names and faces. Good to see you again. Thanks for coming back and spending some time with me, and also some new names and faces, which is always good to see. And really, I really like the fact that SDS kind of gets its courses out there and does a really good job of pulling in new people to our community of therapists and supervisors. So yeah, it was hard 20 odd years ago to get training in how to be a supervisor, and you tended to learn how to be a supervisor by reflecting on what supervisors had done that you'd liked and what they'd not liked, and tried not to replicate the things that you didn't like, but kind of do more of what you'd enjoyed yourself as a supervisee. But there wasn't really many easy to access courses on how to become a good supervisor, and because the field's changed massively since then, and now it's not only possible to get good training in supervision, it's essential for most of the organizations that accredit us that if we want to supervise others, the expectation is we've done some training in being a supervisor. We've got some kind of theoretical models to draw on about how people learn, how you can develop people's skills, how you can get the best out of your supervisees. Which is great, and so there is a really a kind of robust culture now of training in how to be a supervisor. But it struck me a few years ago now. I was running one of the IAPT supervisor training courses in the northwest of England. So it's a transdiagnostic supervision course for counsellors, systemic therapists, cognitive behaviour therapists, parenting practitioners. So taking some broad principles of supervision. An 8-day course, and we were running that as part of IAPT, and it occurred to me that at no point had anyone ever sat down with me and told me how to be supervised, and more importantly, how to get the best out of supervision. And what it was as a supervisee that would enable you to really benefit the most from that supervisory relationship. So John's story and I, John was one of the tutors I worked with, so just started to do a brief introduction to how to get the best out of your supervisor and how to approach supervision, because many people in their beginning of their journey as therapists don't really get an opportunity to think, well, why am I going to supervision, and what do I hope to gain from that? So we did that as an introduction. Now I'm really aware that this is actually on the whole a very experienced group, and many of you are supervisors. Some of you teach supervision practice, have written about supervision. So it's an experienced group of supervisors here, as well as people who are an experienced group of therapists. But all of you are, of course, supervisees. So all of you will be supervised as part of your practice. So I thought it was interesting just to reflect with you, what it is that helps you to get the best out of supervision. And then I think it gives you an opportunity to talk to those people who you supervise about what they might do to get the best out of you, and to give them a kind of framework, really. But this is very much aimed at for all of us, because if we're all in clinical practice, we'll all be supervised for that practice, in line with our professional body's requirements and recommendations. And of course, the supervisory relationship is first and foremost a relationship that mirrors the therapeutic relationship. And we know that regardless of your therapeutic model, the thing that is a kind of very strong predictor of outcomes in therapy is the strength of the therapeutic relationship. So how good is the therapeutic relationship? Now, of course, you need more than just a good therapeutic relationship to bring about change, but without that, no change at all is likely to happen. And the better the therapeutic relationship, the more likely positive changes to take place. So of course, as a supervisee, it's important for you to also work at that relational aspect of supervision, that it's not just something that's a responsibility of the supervisor, it's something that as a supervisee you need to do. And we kind of know what it is that enables a supervisor to build a good relationship with their supervisee. There's been some nice bits of research on that. And what they do is they basically, that research, they interview people who've been supervised and ask them what it was that gave you a good supervisory relationship. And they'll talk about things like the personal credibility of their supervisor, being able to observe their supervisor's practice, having that warmth and unconditional positive regard, and also things like the way that the supervisor gives them feedback. All help develop a good supervisory relationship, which then enables you to learn. But what is it that you can do as a supervisee to help develop that supervisory relationship? It's something that's not been particularly researched and thought about. But as I look at some of the principles of supervision, I'm going to try and hold that idea in mind, that sort of principle that this is a relational piece of work as much as anything. So I just wanted to start by thinking about what is supervision. And supervision is essentially a process by which psychological therapists develop skills and work out how to apply the skills that they've already got to the unique patient that they're working with. It's a process by which we identify blocks in the therapeutic process and work out what it is about what we're bringing, our techniques, ourself. What is it about the patient characteristics that might be causing those blocks? And ultimately, the aim of supervision is to get better outcomes for patients. Really, it's to give your patient the best possible experience of therapy. And that supervisory relationship is really based on two things, I would suggest. One is teaching, and part of the role of the supervisor is to explicitly tell you how to do things, or give you a clear description about what's going on, or the theory underpinning a particular technique that you might be using. And they may teach by just talking to you, or they may teach by showing you in role play, but ultimately it is a taught process. So that's one bit of supervision that's important. But I would argue that more important than that is the process of guided discovery. And what I mean by that is, I think regardless of your therapeutic orientation, whatever kind of therapy model you use, and you'll use different language to describe this process, but in therapy, we give our patients the opportunity to discover for themselves truths about their lives, and the things that make their lives difficult, but also truths about their strengths and what they can bring to overcome the obstacles in their lives. And I think supervision and the guided discovery aspect of supervision is very much like that. The supervisor doesn't necessarily tell you what to do. They give you the opportunity to discover what they do through various different supervisory methods. So I think one of the first things you can do to really get the best out of your supervisor is be willing to take risks and be willing to take chances and be willing to not know. And it's that ability to not know, to hold that position of not needing to have all the answers about the cases that you're struggling with, that opens up a space for some guided discovery. And a skillful supervisor will look after you in that sort of uncertainty and that kind of sense of not knowing, and enable you to remain comfortable with that, enable you to remain in a kind of approach mode where you're able to step towards the dilemmas that you're facing, to reflect on your own processes, to acknowledge the gaps in your knowledge, in order to work out the approach that's going to be in the best interests of your patient. And I've illustrated that through this scene from one of the Star Wars movies, where Yoda first begins to train Luke. And there's some parts where Yoda is very explicitly teaching Luke and showing Luke how to use the Force, how to be a Jedi. But there's other parts where he allows Luke to give it a go and to sometimes to fail. And in that giving it a go and failing, there's the opportunity for learning. But of course, you've got to be open to that, and you've got to be willing to occupy that slightly uncomfortable space. I suppose that's the first point I want to make about getting the best out of your supervisor, and that's allowing guided discovery to take place and being comfortable in their presence with not knowing, and recognizing your own areas of non-expertise, areas that you have skills that need to be developed. Second thing I would say is prepare. Now, and I appreciate that there are some therapeutic traditions that would disagree with me strongly about this. And I remember I used to work with a psychodynamic psychotherapist, and this was about 15 years ago now. And she was someone I used to go to for supervision on cases that I was stuck with, and I would take my dilemma and she'd help me think through what it was about me that was making that situation tough. So I really valued her supervision. But I asked her one time, I said, what's your supervision like when you go for supervision as a psychodynamic psychotherapist from a psychodynamic psychotherapist? And she said, well, I just kind of turn up and kind of freestyle. It just, like, whatever's on my mind that moment comes out, and we work through that and assume that it's useful and important and will give me insights into the work that I'm doing. And I think if that's a tradition that you hold and you find that useful, then great. But I would suggest for most of the therapeutic models that we use, preparation is really useful. And I sometimes get a bit frustrated with my supervisees when they don't prepare. But actually, that's my responsibility anyway, or responsibility of the training courses they're on, that they've not been told. There's a bare minimum before you go to supervision. Think about what you want to talk about. Think about where you're stuck. If you want to talk about a particular case, go read the notes. Do some reflection and sit before you go into supervision and think, what was being elicited for me in that last session? What is it about this case that I'm finding difficult? Why is this a tough process? And I think that preparation enables you to go in with some clarity about what you want to get out of the supervision. Now, of course, during the process of supervision, there are many things that will emerge through that guided discovery, through that supported reflection that you can't have anticipated and wouldn't have prepared for. But having your core questions in mind, so that when your supervisor asks you, so what is it you'd want to spend some time thinking about today? What's our to-do list for the session? Or let's set an agenda, whatever kind of language that they use. Do you have a clear idea about what it is that's difficult? And have done some of the preparatory work in thinking about why it might have been difficult. And that enables you to really focus on the matters in hand and get the best out of this really precious time with your supervisor. Because for most of us, we get 50 minutes a month, you know, it's a sort of a valuable commodity. And so I would say that preparation, thinking in advance, going in with a list of things that are important to you is important, but maintaining that flexibility and that willingness to during that 50 minutes, to also discover things that are important to you and to be open to a reflective process where you can do some thinking with your supervisor about what it is about the therapeutic tasks that are a challenge. So it's holding both those positions a little bit, I guess, that you do need to prepare, but be flexible to work with that which emerges. And if you're more comfortable than I am with the idea of just going in and freestyling, then by all means go ahead. But I would say it is a little bit of preparation that helps. Oh, it's really nice when little ones come and join us. I just want to give a quick wave to the person who's joining Cindy there. Hello, thanks for coming along. You're very welcome. Yeah, some of this might be useful for you at school. So yeah, preparation's useful, but of course you will need to do more than that. So supervisors are human, and supervisors can often be quite busy, may supervise a lot of people, may have a lot going on in their lives, and supervisors need managing a little bit too, and it's quite possible that a supervisor who has got a lot on, who's been supervising a lot of people that day, or who's distracted by other things, or who's just tired, might not be as well engaged with supervision as you would like. And I've certainly been in situations where with supervisors where I've wondered if they were kind of had a little micro sleep, or if they're really listening to me, and if they just kind of stopped being able to focus on supervision and had just dropped into a kind of, yes, that's interesting, please go on, or maybe just repeating the last couple of words I've said. And because that's okay, people are human, and we all have our kind of physical and cognitive limits as to what we can do. But obviously you want to get the best out of your supervisor, and you want to keep them engaged with you. And so what I draw on is the idea of some people know the Yerkes-Dodson law. It's a very old psychophysiological principle that talks about performance and arousal levels. And what Yerkes-Dodson says is, if we want to get the best out of any task that we're engaged in, we need to be physiologically aroused. We need to have like a little bit of adrenaline, be a little bit switched on, enough to engage with the task, but not too much, because if we're too physiologically aroused by a task, our performance becomes impaired. That's too much adrenaline, too much arousal. It can be a bit overwhelming. But also if we're under engaged with a task and under aroused, then our performance is also impaired. And if you think about that in the context of something like driving. So when you're driving, you need to be aware of the road. You need to be worrying a little bit about other cars. You need to be kind of fully present in the moment to drive well. But if you're really worried about your driving, if you're on a road with lots of dangers, if you're driving past a place that's had lots of accidents and you're over-aroused, you'll be too stressed to drive well. But also if you're under-engaged, if you're not really paying attention, if you've not got that slight edge that gives you your concentration, your performance will also be impaired. And it's just the same for a supervisor. So here's the thing. What if you think your supervisor is not that engaged? What if you think your supervisor is kind of a little bit sleepy, or is just sort of dropping back on, asking quite easy reflective questions without really getting to grips with the material? And I think in different therapeutic models, there are different approaches to this. But the one that I would use, and it's one that I use with supervisees who aren't that engaged either. I'll say something like, this is quite a tough task. I wonder if it'd be really helpful if we kind of practiced it a little bit together. What you're doing is you're pulling someone into the present. And what I do is suggest a role play, because if my supervisor is a little bit nodding off or a little bit losing concentration, getting them to role play being a patient or a therapist will bring them into the moment, will raise their engagement and arousal levels and switch them on so I can get the best out of them. So do look out for a supervisor who may be disengaging a little bit. And of course, it's very difficult to call that out. You can't say, it looks like you're falling asleep right now, or you look a bit bored. But you can increase their arousal levels by either bringing something in that's a little bit shocking or contentious, expressing an opinion that will kind of pull them out of their complacency, or getting to do something like a skills practice task or a role play to pull them into something that's a little bit more active. And I think that will keep their arousal levels in the optimal zone, because you don't want an over-aroused supervisor either. So someone who's kind of stressed by the supervisory process. And typically when we do supervisory training, we train supervisors to look out for supervisees who are over-aroused, who are anxious, who are upset, and teach techniques to manage that. Because the power relationship is very much, the supervisor is in charge of the processes during supervision. But as supervisees, you also have a responsibility. And it may be a rare occurrence that you see a supervisor who seems to be overwhelmed or upset. But in that situation, of course, it's absolutely fine to notice that and to take care of them a little bit. Because although there is that kind of inherent power difference in supervision, outside of that supervisory context, you're equals, your colleagues, your people who are both working in mental health, and you're both just people in a tough situation. So it's absolutely fine to take care of your supervisor a little bit if their arousal levels seem a little bit high. So I want to talk a little bit about skills development now. All of the skills we have and may want to have as psychological therapists, whatever our therapeutic orientation, will be the skills that we can do right now, skills that we're not going to be able to do no matter what, at least for the time being, and skills that we can develop with the right kind of support and training and reading within that supervisory process. So it's what Vygotsky calls the buds of skills, or skills to be developed. Or another term Vygotsky uses is skills that are in your zone of proximal development, which means that they're close to what you can currently do and you can be supported into learning them. Now, again, when we train supervisors, we spend a fair bit of time thinking with them about recognizing the skills that your supervisee can develop with your help, and the ones that are outside of their current abilities, that no matter how hard you try, no matter how good a supervisor you are, it's just beyond their grasp. But actually, placing the whole of the responsibility for that on the supervisor seems a little bit unreasonable to me. And actually, when you're going into supervision, you may go in with a skill that you really want to develop. So something that you've read about, something that you think might be useful for a particular patient, something that's going to really make a difference to your therapeutic practice. However, the thing to think about is, at this moment in time, given everything else I've got to do as a therapist, given where I'm at with other skills, given what my priorities are, is this skill within my zone of proximal development? So is it something I can probably develop right now and over the next couple of supervisory sessions with the right kind of support and environment? Or is it a skill that's actually a little bit beyond me right now that I can't quite reach for? And if it is, but you still want to develop it, I think it's really okay to go to supervision and say, look, there's this skill I'm really excited about. It's, for example, Socratic questioning. I want to be able to do a really good Socratic dialogue, but I don't think I'm quite there yet. What do you think you could do as a bridging task to get me closer to that? I think your supervisor might think with you and say, okay, well, actually, I think you're probably right. Full Socratic questioning might be a little bit of a stretch right now, but how about if we just work on asking open questions and sort of use that as a bridging skill to the one you want to reach? But we kind of develop this skill first because it'll get us closer to it, and maybe then over the next couple of months we can work towards your ultimate goal. And I think it's reflecting a little bit as a therapist about the skills you would like to develop and how close you are to being able to develop them when you go into that next supervision. And so using this sort of picture to illustrate that, because Vygotsky was all about how children develop and learn, and how you know, ultimately it's the parent who is noticing the zone of proximal development of their child and helping them to step into those skills. In this example, it's taking your first steps. But of course, if taking your first steps is in your zone of proximal development, running clearly isn't there. So that's the thing for the future. At the minute, you focus on the things that they're just about able to do with a little bit of parental support. It's very much like that with supervision. So keep an eye on and reflect on the skills you're interested in, whether they are in your zone of proximal development or not. And think about that with your supervisor and be very explicit about that. Now, because another one of the great supervisory relationships in 20th century media was, of course, the Karate Kid and Mr. Miyagi. And I think there's something really interesting about, there's an idea, I think, in most explicit models of skill development that there'll be times when the supervisee or the student or the trainee has skills and abilities that the supervisor doesn't. And so some of you will be on training courses and will have learned a new technique that you're really excited about. So you may have gone on to, say, one of the ACT training courses and got really interested in cognitive diffusion and think, well, this is going to open up a lot of possibilities for my therapeutic work. And you may go back to the counseling supervisor that you typically use, or the CBT supervisor, really charged up with a new idea that you're interested in. And of course, it might not be the case that your supervisor is familiar with that technique, or feels confident in supervising you in its use. And there's absolutely no shame in that. And I recognize that I'm kind of towards the end of my career as a therapist and a supervisor. Chances are I'm not going to learn anything radically new over the next sort of 5 or 6 years before I retire. But the supervisees I have will be exposed to new models, will be exposed to new ideas, and will bring them to supervision. And so I think it's really useful for my supervisees to think in advance, is my supervisor going to know this stuff? Will they feel able to supervise me in its use? And sometimes you can make a guess about that, but other times I think it's really okay to ask and to say, you know, I'm really inspired by this idea at the minute. What would it be like if I brought it to supervision? And I think a good supervisor would recognize their own limits and be really explicit about, well, this is something I don't know much about. Maybe we can read about it together. Maybe you could teach me about it. And then if I understand it well enough, we could think about how I could give you an opportunity to think some more and put it into practice. And of course, I actually think a good supervisor would fall back on something like that, because if someone's developing a new skill, one of the best ways to help them really hone it is to get them to teach it to others. So you might even go in and think, right, I've just learned this technique. I've just been on a course. It really inspired me. You've established that your supervisor doesn't feel confident in it. And you might even negotiate, well, would it be okay if I spent 10 minutes next supervision doing a presentation for you about how it works? Because it will help clarify my own thinking. And then it will give you an opportunity to think about whether that's something you might be able to supervise me with, or whether that's something that I might need another supervisor at some point in the future. So it gives you a chance to negotiate that. And of course, as a supervisor, there's no shame in not knowing everything. I think the therapy field is so broad with so many new developments, new techniques, kind of coming online all the time, that it's absolutely fine not to be familiar with one. And as a supervisee, it's absolutely fine to check. And there's absolutely no shame in the supervisor not knowing everything. But it is really useful to check that out and not to make assumptions that just because someone's a supervisor, they are a kind of an expert in every field imaginable. And I sometimes try to be quite clear with my supervisees. For example, a lot of supervisees that I work with are trained in treating generalized anxiety disorder, or GAD as it's sometimes called. And there's a model of GAD that a lot of them learn called the Dugas model that I've been trying to learn and figure out for 15 years. I just can't get my head around it at all. So, and I use the kind of Wells and Clark model, which was around when I trained. Dugas one is slightly more recent. I just can't get it. So I'll be upfront about that, and I'll sometimes say, maybe you could teach me bits of it. You know, if you want to use this particular techniques from the Dugas model, show me how that works. Let me think about that with you. And I think being explicit about those gaps is absolutely fine. So another thing I think as a supervisee, I would say is really helpful is coming to supervision with the things that we're stuck with, or coming with the things that cause us pain or make us uncertain or worried or feel overwhelmed. It's kind of tough. And if I reflect on my early days as a therapist, I think I would have done what most people do, or many people do, around things that are uncomfortable, and that's I'd avoid them. You know, I would not take the stuff that was really difficult to supervision because I might be ashamed of it, or embarrassed about not knowing, or worried about what my supervisor might say. But I suppose as I've grown older, I've learned to be a little bit braver in supervision, and I suppose I really trust my supervisor, and I take the stuff that's uncomfortable, that makes me feel like a bad therapist, that makes me a bit ashamed about my responses to something that a patient might have brought, and I think I get much more out of supervision from taking the stuff that's uncomfortable now, rather than kind of avoiding it and not sort of taking it in. And one way to think about that is, you know, when if we're in our comfort zone in therapy, well, we're just doing the stuff that we can do. We're just doing the stuff that we're kind of familiar with and that's easy to us. And actually what we need to be in is the stretch zone, the zone that is a little bit uncomfortable, that is a little bit difficult, that might elicit strong feelings, to do with our own past, to do with shame, or worrying about our own responses. But actually that's productive. It's being in that uncomfortable zone that will give us the best possible supervisory experience. However, most models of this will say, well, yeah, be in the stretch zone, try not to be in the panic zone, because there may be some things that are just too overwhelming to take. And because you may have a supervisor who's skilled and who can help you negotiate getting back from the panic zone into the stretch zone. But it is worth reflecting again. It's about being prepared before you go into supervision, thinking about, does this feel safe? Does this feel okay at the minute to consider? How's it going to be if I begin to talk about this right now? And to just take the time to reflect and think, really. So that's a broad overview of the things that I think might make supervision a more rewarding process for you. But I hope that the things I've suggested have elicited some thoughts, some questions, or even some strong disagreements, which I'm really happy to hear if it has. And this is your chance to kind of to ask a bit more, scrutinize those ideas, really, or tell me the things that you think supervisees ought to be thinking about.
Yeah, that was genuinely. I was scribbling down a few things there, Andrew, because some of the things I hadn't thought about before, some of them, interestingly enough, I had thought about before, but in a different context. I guess just to start this off, I'm quite interested in this last point that you actually raised about moving into or out of your comfort zone. I'm sort of quite interested at the moment about how I often think that effective therapy is about trying to help the client find or for the therapist to find a sweet spot between, on the one hand, enabling people to feel safe, but also enabling them to tolerate mild discomfort. And it reminded me very much of that. And of course, it hadn't crossed my mind, actually. That's exactly what we should be doing as well within supervision as well. So I mean, there's some other things that have also raised with this, but I will be I'll keep quiet for a moment and throw the floor open to other people if they've got particular things that they either want to pop into the chat box, or alternatively just raise your hands, folks, and jump in and ask about it.
Thanks for that, Paul. Can I just make a quick response to that? Because I do think
sure.
a lot of what supervision is like therapy is like, and a lot of the kind of processes that we see in therapy hold for supervision too. I mean, the purpose of it is a little bit different, isn't it? But I think it's a good point. Whatever the model of therapy is that we are using, our supervision will have many of the same things going on, really. So you're absolutely right. Yeah, therapy does involve helping people be uncomfortable.
It is. Yeah. And that, you're quite right. I think that's where growth occurs, whether you're a client or a supervisee, basically. Yeah. Questions? Do you want to? Have you got a better eye on this than I have, Julia?
I think we all have equally good eye. I just don't know who prefers to read them out. I'm happy to read them out.
Yeah, fire away.
Andrew, do you want me to read them out?
I'll tell you what,
or you want to do it yourself?
I'm just scrolling through. Let's see, I'm just getting through the hellos at the minute.
The questions start with Nori.
Okay, hi Nori, thanks for that question. So the question is supervision only about being stuck? But it also can be about reflection to support progress and success. Yeah, you're absolutely right, Nori. There are many aspects to supervision, some of which is about celebrating successes, tracking progress, thinking about when things have gone well so you can apply that to other cases. You're absolutely right. There is a lot more to it than just being stuck. And I think if your supervision sessions are only about the times that you're stuck, you'd end up being a bit demotivated. And I always like to hear about people's successes. So I completely agree, Nori. Yeah, that's a really good point. So Patricia's nice point here I want to pick up on. So what you said about what to take to supervision is important. Things people might carry around, dwell on after a session. Yeah, that's true, isn't it? The stuff that's still on your mind a few hours or a few days later is almost certainly something that's worth taking it. And also reflecting the comparison between the comfort zone and the panic is important. Sometimes we struggle to see how we impact a scenario ourselves. That's right. And I suppose it's the supervisory process that can help understand what it is that we've brought. And from my kind of therapeutic perspective, as largely a cognitive behavior therapist, the questions I might ask a supervisee are things like, as you noticed that happening in therapy, what was going through your mind at the time? What were you thinking? And how did those thoughts impact on your emotions? What can you remember about your emotional state when that happened? And how did you behave as a result of that? Now, actually, that's no different to a psychodynamic psychotherapist eliciting transference and countertransference, really. We may use a different language to be interested in the same stuff about what we bring. But you're absolutely right, Patricia. It's really helpful. So Sarah, I'm interested to know how important you think it is to contextualize difficulty within the session as a whole. Yeah, that is interesting, isn't it? So do you do a kind of zoom in around a particular kind of moment of interaction that was difficult, or do you take a kind of a really panoramic view of the whole of that session, the whole of the therapeutic process, where someone's at in their therapy journey, and understanding the kind of life and context of the service user? And oh goodness, Sarah, if I'm honest with you, my answer is I don't know. And I think there are times when probably a really fine-tuned look is useful, particularly if you're doing live supervision and reviewing recordings. It can be fantastic to hone in on a moment that was problematic, say. But also, I mean, I really like my supervisees to paint a picture of the person that they're talking about, you know, their age, their gender, their ethnicity, their socioeconomic positioning, their family positioning. So I suppose it may depend a little bit on your therapeutic orientation, but I can see the benefit of both, Sarah. So thank you for that. Oh, okay. Now, Hazel, whilst acknowledging that at any stage of our careers, we have room for growth, what can I say about how to achieve stretch for the experienced counsellor who may be supervised by a colleague who's not necessarily more experienced? Yeah, that is a good question, isn't it? First of all, I would say that idea of experienced therapists and supervision, when we think about Premier League footballers, they of course don't say, I'm not going to go to training this week because I'm a Premier League footballer, I already know how to play football. There is a really clear sense that skills practice is essential, whatever level of expertise that you have. Now, do you necessarily need to be coached by someone who's a better footballer than you? No, and probably not a better therapist. I mean, I'm going to say something a bit bold here that you're welcome to totally disagree with me about. Good supervision is not about the answers that you give your supervisees. It's about the questions that you ask them. So you don't necessarily need a massive amount of knowledge to be a good supervisor. You just need to have a good structured way of asking questions to enable people to discover for themselves useful new perspectives on the cases that they're stuck with. So I would say an experienced counsellor with a less experienced supervisor, as long as the supervisor can ask good questions, will probably be all right and could probably still get quite a lot from that. But really nice question, Hazel, thank you. And I was glad to get the chance to use my Premier League footballer analogy, which used a lot in supervision training. So it's good to get that one out this evening.
Yeah, it is. Yeah, I mean, it is an interesting question. I mean, gosh, a number of things come to my mind on that. I sometimes wonder whether the purpose of supervision with more experienced practitioners is the same as the purpose of supervision, for instance, for people in training, whether it is actually, whether the aims are the same. And I suppose the other thing, just to follow on from what you were saying, Andrew, which I think's interesting, is that being an experienced practitioner doesn't necessarily make you a good supervisor. No. When that phrase is used there, I mean, yeah, I would ideally like an experienced supervisor. It doesn't necessarily mean that they have to be an experienced practitioner. Yeah,
that's a really nice point. Yeah, the two aren't the same, are they? That's a really lovely point, Paul.
Yeah, interesting point. Yeah. Can I, if there's no one else coming in, I'm just so interested in this area, can I throw in another question, really, which is a sort of broader question? Is being a supervisor different or the same as being someone's mentor? Is the process, I mean, I've come across folks, I mean, because, in a sense, is this just about choice of words and choice of language? Or are they the same? Are they different? If they're different, in what way are they different?
So, Paul, we've worked together a long time, and you've seen me after a few drinks as well, so you know how opinionated I can be about stuff.
Please be.
So you're getting me being opinionated now, aren't you?
Yeah, of course.
And I'm going to say they're totally different. But I'm happy to be completely shot down on this one. Because I do mentor people. I never talk about their clinical work when I mentor people. I never ask about patients. It's about their progress and their professional position and how they manage professional relationships and how they're working towards their personal goals in a broad sense. But it's not about how that plays out in the moment by moment therapeutic process. So I would say supervision is always in the best interest of patients, and it's about getting patient outcomes. Does that sound totally outrageous, Paul? Or
no. I mean, to be honest with you, I haven't got an opinion on it. I mean, it's just that to be honest with you, I've had that question thrown at me in the past, and I thought I would find out what answer to give in the future by asking you now.
Good thinking.
So, yeah, but it does come up. It does come up. And I think it particularly comes up in professions where the concept of clinical supervision isn't so well established, and it's a newer process that's been introduced, and where where in a sense, I think sometimes people are more familiar with the idea of mentoring, and it's almost like it's a confusion between the two for some folk, and whether they're the same or different. Yeah.
Yeah, and like, you know, I bet some supervisors in their session, they do some supervision and some mentoring.
Yeah.
But they are distinct. And as long as you've agendaed for that and you've thought, well, we're going to spend some time thinking about your career development, and we're going to spend some time thinking about these patients, then at least you know where one ends and the other begins.
Yeah. Yeah. Great question here from Maria.
Would you give space for a personal issue? Yeah, that's really interesting, isn't it? Because I think, again, you know, what's the difference between mentoring and supervision? What's the difference between supervision and therapy?
Yeah.
And of course, there is a difference. We've contracted for something very, very different. But it's often really important in supervision to bring your own stuff. And to at least acknowledge how your own stuff is impacting on the work you do with the patient, but it's not your supervisor's job to resolve that stuff with you. That's for you to seek therapeutic support if that's appropriate. There's a question that's come directly for me rather than to everybody that I just want to pick up. Have you had a bad supervisor, and how have you known that it's time for a change to get the most out of it? Yeah, great question. Yes, I have. You know what? I tell you, for me, a good indicator was, do I look forward to supervision with them? Because I love being supervised, and I really enjoy taking my stuff to supervision. And if I had a supervisor where I didn't feel that sense of joy and happy anticipation, that for me would be a good indicator that it wasn't working, really.
Very much.
Nice question, though.
Yeah. Is it Cashel? If you like to unmute.
Can I ask something about ethical? When in my first session with the client, I say I have supervision because it's an ethical issue. And what about when your your supervisee is not practicing in a way that you think is appropriate?
Oh, Cashel, you've asked me a really tough question. And yeah, I mean, and probably like you, I've experienced situations like that where I've been really worried about the practice of a supervisee. So I think it's a really important question, and I'm going to ask your take on it when I've given a quick response, which is, I suppose when I start supervision with someone, I do a supervisory contract, and that will include, what do I do if I'm worried about your practice? So we've already agreed in advance how we'll handle a situation like that and talked it through a little bit. Which means that if I am worried, I can say to them, you know, this is one of those times that I mentioned before, and we said that if we couldn't resolve it between us, then we'll get your line manager involved. And so there's a sort of, hopefully, a pre-existing agreement. If there's not, then of course what you can do is go back to your supervisee and say, I was on this training course and it mentioned how useful it is to refresh therapy contracts. Could we just do that together? But then all of us will be registered with a body, whether it's BACP or HCPC or AFT, or all of which have codes of conduct that will be very clear about the need for ethical and good practice, and how we respond if we're aware that someone that we're supervising isn't acting to those codes. So there's a sort of legal or quasi-legal framework to help us with that too. But Cashel, I wonder how you'd kind of manage situations like that, or what your thoughts were about it.
My difficulty has been in peer supervision when there's 4 or 5 of us and supervising each other, and I'm concerned about one.
Oh, that's tricky, isn't it? Because you've probably not got that explicit contract then of like, what do we do if we're worried? And in the therapeutic model that you're working within, would it be okay in group supervision to sort of to raise that and say, you know, there's lots about your practice that I like, but I'm really this bit that you've described really concerns me. I wonder as a group how we might respond to that and sort of share your dilemma a little bit with the group. Would that fit with your kind of therapeutic modality, Kishal?
Well, my peer groups have been from totally different modalities. They've been 4 different modalities.
I bet that was fun.
But we have an agreement, or I believe we have an agreement to critically discuss concerns. But we've fallen out on the day, but you know, repaired the relationship afterwards. But yeah.
Yeah, that's a nice point though. That kind of rupture repair model works in supervision too, doesn't it? And we can, as mature therapists, kind of manage those difficulties. That's a really good question though, Kishal. Thank you for that.
Very good. Yeah.
Oh, okay. Follow-up question
we're
here.
quickly approaching 8 o'clock. So shall we say last question, Andrew? And
Yeah, I'm going to
wrap
take one
up
that came direct from FA again. If you want to change your supervisor, how do you approach them without it being awkward? I don't think there's any way of doing it without being awkward. That's going to be a tough conversation, isn't it? It's a bit like breaking up with somebody. You could say it's not you, it's me.
yes.
But oh man, that's a really tough question. But I suppose, I mean, all supervisory relationships come to an end, don't they? And often that's just because you change jobs or they change jobs. But one of the things I'll often say to my supervisees is there might be a time when what I bring as a supervisor isn't right for you, and it's absolutely fine for us to think about getting you a different supervisor when that's the case, to almost build that into our contracting, and sometimes have a kind of contractual review agreed like every 12 months where we'll get their line manager in as well. Grzina makes a really good point. It's a contractual relationship, so endings should have been covered. I think that's right. That's a really good point. So there may be natural junctures at which you can renegotiate who your supervisor is.
Yeah, great.
I think, Andrew, I can sense that we should invite you again soon, or maybe in the next sort of 6 months, in a 6 months time or something like that, to just continue this conversation.
Yeah,
but I just wanted to say to everyone, lots of questions which we were discussing tonight are covered in our essential supervision skills course, because I was sitting and I thought, oh, I know the answer to this one and to this one because I've been to Paul's course. So if you're interested, please have a look at BPS approved certificate in clinical supervision in SDS, on SDS website. And it's also one of the shortest courses in supervision if you're a psychologist, which enables you to register for RAPS. So that's an advantage of that course. And also, if you liked working with Andrew tonight, have a look at the list of the courses which he's done for us, and feel free to choose something for yourself, because it's always incredibly enlightening and fresh working with Andrew. He's got a fresh perspective on everything he teaches. So thank you very much for coming. Yes, I always appreciate your thanks at the end. I can't remember when we're meeting. We're definitely meeting in February. I don't think we have any more January Thursdays. We will see you in February. And thank you very much, Andrew. Thank you very much, Paul. You can unmute yourself, say your goodbyes, and we'll see you soon. Stay warm.
Thanks, everybody.
Bye. Thank you.
Take care,
Really
folks.
stimulating
Take
evening.
care. Look after yourselves.
Thank you.
Take
Thank
care.
you.
Take
Thank
care.
you. Say
Take
goodbye,
care.
Elsa.
Bye.
Have a good
Thank
evening.
you. Bye.
Have a good evening. Take care.
Bye.
Take care. Take care.
Thank you for coming.
Oh goodness, my friends.
Take care.